Alright, so we're quickly trying to move at another terminology in obstetrics, yeah, giving birth, pregnancy and all of that. So this is what is known as a preterm labor. Preterm labor. What's the term? So you have pre, have term, you have post term. So for the pre, of course, you can start suspecting that it's something that comes before time. Okay. So preterm labor, we said that it's also called what? Premature labor. This is usually when labor begins before 37 weeks of pregnancy. So before 37 weeks, you already have labor, pregnancy. You already have the labor. You understand? All right. So it's a serious condition because babies born too early can face health challenges. Especially with breathing, feeding, temperature regulation. Okay. So key signs and symptoms is what? Regular contractions. That's like for the preterm labor. It's also known as premature labor, right? So the woman is having, regular contractions. There's lower back pain that doesn't go away. There's menstrual-like cramps or abdominal tightening. There's pelvic pressure, a feeling that the baby is now pushing down, So vaginal bleeding or spotting, change in vaginal discharge, fluid leaking from the vagina. All of these are signs of premature labor. So risk factors is what? If the mother previously had the same issue, all right, in this new pregnancy too, she has that risk. If she's carrying many babies, twins, triplets, there's uterine or cervical abnormalities, there's infections, right? Smoking, substance use, poor prenatal care, all right, chronic conditions like what? High blood pressure or diabetes, right? So diagnosis and management is just based on cervical changes and contraction patterns. So you're trying to see if she's having regular contractions more than 6 per hour, all right, more than 6 per hour. Okay, so treatment is what? Tocolytics. These are drugs that will basically stop contractions. Corticosteroids, they help mature the baby's lungs, right? If early delivery is likely, there's nothing you can do about it, so you just have to hasten up the baby to prepare for the outer world. Magnesium sulfate to protect the baby's brain if delivery is imminent. Bed rest or hospitalization in some cases. So outcomes is not all preterm labor leads to preterm birth. Some cases can be managed successfully, all right, to prolong pregnancy. But when birth does occur early, neonatal care teams are ready to support the baby's development. So that's just it for the whole concept of preterm labor or premature labor.